All right, everybody, and welcome back. We're going to be going over Medicare Advantage, also known as Part C today. You have quite a bit to go over, so we're going to jump right into it. It's really a lot of information here. Starting by how to obtain your Part C. It's offered by private insurance companies, so again, like your Anthem, Blue Cross Blue Shield, your Humana, United Healthcare, etc. Now, plans can differ by county and or state, and that's even if the plan name is the same. So, for example, if you're on the Anthem Medicare Advantage in Connecticut, that's going to be different from the Anthem Medicare Advantage down in Florida. All right. Now, there are also employer-sponsored Medicare plans. They're pretty rare, but if you might be able to get one depending on your employer. Now, in order to get to the Medicare Advantage to get the Part C, you must have both Part A and Part B. That is a requirement there. Now, you must also have an election opportunity. This is basically an opportunity to enroll into a plan at a set time. Now, some of the common ones are going to be AEP, which is the annual enrollment period. That goes from October 15th all the way through to December 7th. You're going to have OEP, which goes from October the 1st down to March the 31st, excuse me. You also have MDE, which is if you have Medicaid and Medicare or LIS. They'll also give you an opportunity to enroll into a plan, but there are some other opportunities. For example, if you lost employer coverage, if you just moved. So there's a lot of opportunities out there, so you shouldn't have any problem getting into a plan unless for whatever reason you don't have your Medicare Part A or Part B. Now, what does Medicare Part C actually cover for you? So it's going to cover everything that Medicare Part A and Part B cover. It's also going to have additional coverage for things like your dental, vision, hearing, and health insurance worldwide. Many plans also have allowances for things like groceries, over-the-counter items, even your utilities. And also, they have additions that will vary by plan, carrier, location. Some plans have what's called a Part B give back. So some of that money you're paying for your Medicare Part B can actually be put back into your Social Security by a Medicare Advantage plan. Now, all of these benefits do vary from plan to plan and by carrier and by location. So again, if you're in Florida, the benefits you get may be different from going up into Connecticut or Maine. Now, I know a lot of you are wondering what kind of money do you have to pay to get into one of these Medicare Advantage plans? And the good news is that the vast majority of them have no additional premium you're having to pay for it. Now, premiums are subject to carrier. And so some plans, again, do have that $0 premium. Most of them do. But some of them do have an additional premium as well. And those plans that have the additional premium usually come with extra benefits, extra allowances, that kind of thing there. Now, some plans do also have deductibles for either your medical coverage or your prescription drug coverage, if not both. So, those four options there. You can either have no deductibles, deductible only for medical costs, deductible only for prescription costs, or no or deductibles for both. Excuse me. Now, I have it put under costs, but this is one of the things that do separate and differentiate a Medicare Advantage plans from your regular Medicare Part A and B, which is that instead of paying the 20% coinsurance for your medical services, you'll generally have a set copay. So, for example, instead of a doctor's visit being 20% of whatever the doctor is charging, you have a copay of maybe $5 to go see your doctor. Now, all Medicare Advantage plans do have what's called a maximum out of pocket, which is a limit on how much you, the policyholder, can pay out of your pocket. Now, these do again vary based on the carrier, area, and plan, but regardless, all Medicare Advantage plans do have that cap, and once you hit it, the plan will pay for the rest of your covered expenses for the rest of the year there for you. All right, now, so your prescription coverage, the majority of Medicare Advantage plans do include prescription drug coverage, and you cannot have both a Medicare Advantage plan and a prescription drug plan. So if you do get a Medicare plan a Medicare Advantage plan that does not have prescription drug coverage, you won't be able to get a standalone prescription drug plan either. You'll be having no drug coverage unless you're getting it from elsewhere, like the VA, TRICARE, or the Indian Health Services. Now, Medicare Advantage plans also have what are called special needs plans within them as a subcategory. Now, special needs plans are Medicare Advantage plans that are tailored to specific needs or situations. Now, there are three kinds of special needs plans. You have dual special needs, chronic special needs, and institutional special needs. Now, dual special needs plans, DSNPs, require both Medicare Part A and Part B and Medicaid. And plans additionally vary based on the level of Medicaid received. Now, I gotta remember Medicaid is a program through the state to help reduce your cost. And if you have a full level in most areas, that'll actually reduce your overall cost to $0 for your medical and prescription coverages. Now, chronic special needs plans, also known as CSNPs, require a Medicare classified chronic condition, and eligible conditions do vary by plan. So, for example, if you have a chronic condition like a lung disease, but there is not a chronic plan that's for lung diseases or lung problems, then sadly that doesn't qualify you. Now, the common qualifying conditions do include diabetes, lung failure, end stage renal disease, and heart failure. And then once you sign up for a plan, chronic conditions must be verified within 30 days of enrollment and are reconfirmed at least annually. Now, we also have those institutional special needs plans, and those restrict enrollment to people who have had or are expected to need an institutional level of care for more than 90 days. Now, within your Medicare Advantage plans, you do have different kinds of plans. So you have your HMOs, PPOs, HMO POS, PFFS, and MSAs. Now, HMOs do have a network, and doctors seen or procedures done outside of the network are not covered and would often require a referral before you go to see said doctor or have said procedure. Now, PPOs offer the most flexibility, but they do have a network, but they also offer coverage outside of it, although that is generally at a higher cost. As long as your doctor outside the network will take payment from the plan, you're able to go see them without any kind of issues. And so, for example, if there was a specific doctor you wanted to see, but no one had them in network, you could get a PPO plan that would still allow you to see them outside the network, again, generally at a higher cost. You also have HMO POS plans, which are trying to give you the best of both worlds with your HMO and PPOs. So they do allow some ability to go outside of the network at carrier's discretion. So it would be up to the carrier whether or not you're able to go out of network for certain services. Like if you want to see a primary care doctor out of network, they would have to be confirmed or deny that. Now, the next two types of plans here are extremely rare, and I'll be honest, I've never seen them in the wild. So your PFFS, yeah, say that right. PFFS plans usually charge a premium and sometimes have prescription drug coverage. And if the plan does not offer drug coverage, you can get a prescription drug plan. So you can have a PFFS plan and have a prescription drug plan as well, which with a normal plan like an HMO or PPO would not allow that. Now, MSAs may have a full network, partial network, or no network at all, and they do not offer prescription drug coverage. So with a Medicare Advantage plan, they do have prescription drug coverage. At least most of them do have prescription drug coverage on them, and those are structured the exact same ways as a PDP. Also, most Medicare Advantage plans allow you to see a primary care doctor in network at no cost at all, which would generally make it cheaper for most people to see their doctors get their services. So if you are generally healthy and you only go, say, once a year to see your primary care doctor for a physical or a checkup, and now instead of paying 20%, you're paying $0 for it, that just saves you more money in the end, especially if the plan itself is at a $0 premium. Now, as I said earlier, premiums are subject to carrier by population. They're informed by the area, by the population of people on Medicare in that area. The more people there, generally, the lower cost will be. So, for example, in Los Angeles, most plans have $0 costs for almost everything except emergency room and urgent care visits. While premiums are subject to carrier, they are generally informed by the area the plan is in. And generally, the higher the population of Medicare recipients in that area, the lower the cost will be. Now, Medicare does have a cap on how high a plan's maximum out of pocket can be, but most plans fall well short of it. So, one's not wanted to write down, and I'll just mention it here. Now, MAO plans are Medicare Advantage plans that have no drug coverage, MA only, Medicare Advantage only, and they're usually reserved for those who have drug coverage in another way, like say they're getting from the VA, Indian Health Service, TRICARE, etc., or those who wish to go without drug coverage. And special needs plans generally have higher benefits than non-special needs plans. So that's it for the overview of the Medicare Advantage, the Part C options, what it does for you, how it is an advantage to you, and how it might be able to help you in your situations. Of course, if you have any questions, feel free to leave them in the comments. I'll be happy to help you out. You have a wonderful rest of your day.